sometimes get into this little bubble where they keep going back to an injector or a doc that doesn't know how to say no to this person.
Yeah, we Flossom talk.
Hi and welcome to Flossom Talk. I'm Shashti Floor, journalist, Hollywood truth teller, and your voice of reason in a town built on delusion. So I don't know about you guys, but I have noticed a lot of weird faces walking around on red carpets lately. And that's why I wanted to get in touch with a plastic surgeon in Beverly Hills, which is kind of the epicenter of plastic surgery in the world. So I wanted to ask a professional his opinion on what's going on right now. Also, I wanted to know about the consequences for people putting too much fillers and Botox in their faces and also using Ozempic and what it could do to your face and the damages that it could actually cause your health. He also revealed all the things that you can actually do to look younger and more refreshed without going to the extreme. So if you want to age more gracefully, you have to listen to this. Here is Dr. Nathaniel Villanueva. Thank you so much for being here. I have so many questions. I mean, you are in the middle of the world's plastic surgery center. Would you say that Beverly Hills is like the center of the plastic surgery world?
Yeah. Beverly Hills, there's a lot of interesting things that happen in this town. We're really close to Tinseltown. And so there's a lot of interesting stories and fun things that happen, both good and bad. But yes, definitely.
I feel like we've seen a lot of the bad ones lately. Maybe those are the ones that we notice the most. I think some people who had great plastic surgery, we won't even notice, but there's a lot of bad ones. What do you think happens? Because I think that, you know, if you have so much money, like a lot of these celebrities do, why do they end up looking weird?
That's a great question. And the thing is that access doesn't always mean access to the right resources. And I think the issue too that comes about, and I've seen it happen in town, is that when people are dealing with celebrities, they start to be yes people as opposed to being critical and analyze. And like you mentioned, I think you hit a very important point, is that the best plastic surgery is the one that's least detectable, right? And people just look natural, good, and beautiful. And so what sometimes happens is in the setting of this world where people always say yes, there's sometimes get into this little bubble where they keep going back to an injector or a doc that doesn't know how to say no to this person and keeps filling or keeps doing these, procedures that starts to change the natural appearance of the person. And then we see these overfilled or overcorrected, interesting looks that aren't as attractive as the person would naturally be.
Yeah, I think there's a very fine line there. And I feel like some people think that, a lot of this stuff can make you look younger. Do you think that it's possible to look younger? I think that, for me, I would always just try to look the best for my age, whatever. But I think people think that they can look 10 years younger if they do certain things. Is that possible?
So I don't think it's possible to totally reverse time, right? But you can look like a better version of yourself at any given time. And there's a lot of things that create that, right? And a lot of things can start while you're young and you still have the opportunity to slow father time, right? And there's a couple of basic things that start with just basic skincare, cleansing your skin, using a moisturizer, using sunscreen. Sun is the enemy to everybody's skin, right? And sun causes DNA damage. It causes collagen damage. It causes wrinkles, causes pigment changes. And all of these things lead to early aging, right? And so I think in the people that we have seen in terms of the celebrity world that have really nice aging, elegant aging, the first part of that whole process is taking care of their skin, right? And then as people age, there are things that can be added to the treatment plan to slowly progress aging. And I think one of my mentors, and he's now retired, his name was Fritz Barton, fantastic plastic surgeon out of Dallas, Texas, where I trained. And he described that plastic surgeon's goal is to help a patient age as gracefully as they want, right? And for some people, that means surgery. And for some people, that means skincare, right? And so that's where I think the beauty of plastic surgery and really helping people transition into older age with the elegance that they want is very different, right? But I think the fountain of youth that people are sometimes looking for to make them look 10, 20, 30 years younger is, I think, a little bit of a pipe dream, right? But we can make people look a little bit more youthful in their given age group. And I think that's how we starting to see that some of these older celebrities, they look great. They look great for their age. They don't look like the younger version of themselves. They just look like a great version of themselves at their given age. Does that make sense?
Yeah, totally. So what do people come to you for now? What kind of surgery are like on the rise? Is there like a trend that you see?
Right now, I think one of the biggest things that is being thrown out there is the deep plane facelift. And I think one of the biggest people that a lot of people are talking about right now is Kris Jenner, because she became public about having a facelift, right? And we know that it's not her first, because she's talked about in the past that she's had a facelifting procedure. And so we know it's her second procedure. And the conversation about the deep plane versus a traditional facelift or the different types of facelifts, I think the technicalities of that term get very confusing for the layperson, right? Because we're now using technical terms within plastic surgery to describe the procedures that are being done. And when that term deep plane comes up, it refers to doing a surgery below something called the SMAS, which is the superficial musculo-aponeurotic system, okay? And what that is essentially the muscles of the face. So you have your skin, you have your fat, you have the muscles of the face, then you have deeper muscles, and you have the bone. And so doing surgery under that plane is considered a deep plane. However, there are other techniques that move that same plane that people are using off-label as quote unquote deep plane, but they're not the true deep plane procedure. And so there's a lot of kind of misuse of this terminology out there. And to be honest, it doesn't really matter. I think at the end of the day, for somebody that's looking to rejuvenate their face, there are various things that can start. One is skincare, right? That's the first place. The second is, where is the aging happening? Is the aging happening in the eyes? Is the aging happening around the mouth? Is the aging happening in the neck, right? And different people age in different phases. Some people, they start with the eyes. And so a simple procedure to address the eyes is what we call upper blepharoplasty, which is getting rid of a little bit of the extra skin on the upper eyelids. And sometimes that's combined with a brow lift, right? And that the brows start drooping and we start losing the shape of the brows. And so sometimes folks start with that. And there's, different celebrities and different folks that they're like, why did they look a little bit more awake? And if you start looking closely at the photos, you start to notice that something's changed around the eyes. Sometimes it can be done with something minimally invasive like Botox, right? That you freeze the muscles that bring the eyebrow down. And so it slightly elevates the eyebrow and slightly opens up the eye, giving a little bit more of a youthful appearance. And sometimes it's something a little bit more surgical or invasive. And that's done with little incisions that's stuck in the hairline that's not visible, and a little incision on the upper eyelid that helps get rid of some of the extra skin on the eyes, right? The other thing that we look at is the around the mouth, the nasal labial folds, these lines that are created. Now, overfilling these lines can start making you look non-human. And that's one of the biggest mistakes that I see happen a lot, is that people get overzealous with filling this line and trying to erase it. Now, the perfect example of youthfulness is a child, right? If you go look at kids and you see them smile, they have nasal labial folds. So these are not totally aging features, right? I think there needs to be a little bit of a nasal labial fold, but we can soften that transition from the cheek to the lip with a little bit of filler, and that can be done with fillers, or it can be done with fat, or it could be done with repositioning the cheek, right? When you reposition the cheek, you elevate some of that volume that has sunken and dropped over the aging process, and it helps kind of soften this transition into a more youthful appearance. The next thing we look at is the jowling or the marionette lines here, right? Because the volume that occurs here, you can't fill that to make that go away. So if anybody tells you go put a lot of filler here to soften that, that's where you start to get a really heavy jawline. And that's where people start again to look a little bit overfilled and overdone. It's much better to do a neck addressing and a lower face addressing procedure that can be done with a little incision that's hidden right in the ear line and goes behind into the hairline to help elevate that lower face, right? And there's a couple of different techniques. And I think the truth of the matter is that there's a lot of very good surgeons out there and a lot of people that can successfully complete these operations and make people look a lot more youthful, but still look like themselves. And your best bet is looking at before and after photos. And that is the number one thing that I recommend to all patients is find the before and after photos. If the surgeon's willing to show you before and after photos, look at them. If you like how they look and it's consistent, then that's somebody that you should trust and you should go to them, right? Where you start to question is when there's not a lot of before and afters and there's a lot of excuses as to why there's not a lot of before and afters, and I would start questioning.
So I feel like now we've seen a lot of men, especially in Hollywood, doing things which we haven't really seen that much of before. And I think a lot of people, like a month ago now, when Bradley Cooper came to a red carpet looking like a completely different person. What do you think? I mean, so many people have guessed. What has he done? What do you think that he did? And do you think that he looks good?
Yeah. So, that's a tricky one, right? Because we don't have any admission from him that he's done anything, right? So I want to make that clear. I don't know any secrets. I don't know anything on the back end that I can say, oh, I can confirm he's done this, or this. However, when we see a fuller face that might have some puffiness to the face, right? That is not the typical appearance of what we're used to. There's a few different things, and not all things are surgery that can cause that, right? You can have a skin resurfacing treatment, like a laser treatment to help improve the appearance of the skin that can make your face really puffy and swollen, right? There's also fillers, right? If you do a filler treatment, and it could even be a filler treatment from the past, that you do a filler treatment in the past, and let's say you have, you get a little bit more filler and now you've augmented that swelling significantly more, then that can really dramatically change your appearance. And the hard thing is that a lot of these folks have time slots in which there's a lot of photos being taken all at once and there's not a transition, right? And that's where we can start to create these moments in time where people are like, oh my God, you did something. You look totally different, right? And, where I think where good treatments and good care for somebody deviates from that is where you can't notice it. It's a small, gradual transition to that more youthful appearance.
So I think someone like, for example, Brad Pitt, you can't really say that he's done something. But do you think he's done a lot of things? I have a feeling that
I can tell you that, again, he's another person that has openly said he's never done anything. However, he does have a skincare line, right? And so there are things that he is admitting to in terms of taking care of himself and doing his skin.
I got a morning wash, I do my serum, I do my day cream, and I'm done. I'm out the door. So that's me.
And, it's one of those things that with him, the youthfulness may be a component of genetics, right? He's a handsome man. He takes care of himself. He has a healthy lifestyle. I guarantee you he does good skincare. Now, some of the things in terms of the neck and how that appears and how that has kind of evolved, it's possible that there is a surgical procedure that has been done or just really good genetics. But I think he's one of those people that we're not quite sure. And that to me is probably really good surgery or just really good genetics. But I think it's one of those two.
Okay, so what about David Beckham? Because he also appeared looking a little different recently. Have you seen those pictures of him?
Yeah, I have. And, David Beckham's an interesting one. Again, all of these guys, and I preface this because I don't want to be a clout chaser. I'm not trying to say that I know what anybody's done, and that's not the goal here, right? I think it's an interesting study of humanity and people that we all feel at various levels are attractive humans, right? Both male and female. And so I think a lot of these folks are unique because they're public figures, right? That we see. And when we see them, we're looking at them with a memory of how attractive they were and how attractive they currently are. And we're comparing a lot, and we get to compare a lot. And it's fun to talk about these things, right? Because it's like, what are they doing? How are they doing it? How can we look like them, right?
Of course.
And so with David Beckham, I think there's something really interesting that has occurred. So one of the things that I looked at with him is actually his hair. And the hair is one of those giveaways of youthfulness, right? And now, again, he's never admitted to anything. However, there are non-surgical treatments that can improve hair growth. There are injections of PRP, PRF, which is platelet-rich plasma that you can inject into the scalp that augments hair growth. There are a lot of different treatments that are not technically surgery, right? So you don't have to ever admit to having surgery that can improve the hair growth. And that also changes the frame and the structure of the face. A lower hairline actually makes sometimes a more youthful, more attractive facial structure and features, right? Now, it was interesting because there was some photos that were taken that he looked a lot more youthful per se, right? And then I recently saw a video of him that he was posted to his Instagram, and it was just in his natural environment, no lighting, no touch-up makeup, nothing. And he looked like himself. He had wrinkles on his forehead. There was movement around his eyes. There was little crow's feet. And so little things that we see that are appropriate for his aging, that, you know, and that's the other thing too, right? That we need to take into account when we're seeing some of these stunning photos is these lights really wash out a lot of the little details, right? Anybody that has a ring light nowadays, they look awesome in front of the ring light, but then if you change it to an overhead light and you change the direction of the light, you'll start to get a lot more shadowing. And that shadowing can then create the illusion of an aged face when you're not really aged. It's just good lighting and good angles, right? And so I think with him, I think that might be some of what we saw in some of those photos, that he looked a lot more youthful, because I think there's really a transition between that and the photos that we see that he looks more age appropriate. But again, I think there are things that he's doing to stay healthy. He's, you know, has a healthy lifestyle and is probably doing stuff to take care of his hair and keep that, you know, handsome look he has.
Do you think Ryan Reynolds did something to his hair too? Because I feel like his hair is, he's getting more hair.
Yeah. And you know, it's one of these things that a lot of these guys, if you start to think about it, right, they come back and their hair's more full. And there's options, right, that are surgical, like hair transplantation, that now is a little less detectable when it's being done properly, that you get single follicles, like single hairs that are transplanted to the front. It's unlike the old hair transplant of the past where people would have plugs on their forehead that are total dead giveaways, right? And so with these more advanced techniques and all of the extra care that we have available to us with the scientific advancements and the studies that are going on to give people the best opportunity to really have a nice change in their aging, right? Because that's something that both men and women experience in terms of aging, is that hair loss, right? And so that really is a component to the facial aging, in addition to good skincare and in addition to maybe Botox and you know, a little bit of filler, and even, like I said, good surgical procedures that conceal the aging of the patients.
And then you have people like, you know, Simon Cowell, who I think has gone way overboard.
Simon's an interesting one because he's actually admitted to having fillers, right? He's openly discussed it. And he even himself was like, I overdid it. I overdid the filler. I overdid the Botox. And kudos to him, right? Being a public figure and just taking it and being like, yeah, I did that.
But is it reversible for him, for someone like him? I feel like he has admitted to doing it and then he just does more. And every time I see him, I'm like, why? Like, do you think there's like, is it reversible? And do you think that we've reached some kind of filler blindness? I heard that expression the other day from someone on YouTube saying that you don't even notice it anymore because you just get blind to it.
I completely agree with you. I think there is that phenomenon of filler blindness, because once you see somebody that has already changed their appearance, you get that initial shock, and then you continue to see them and they continue to add more, and then you just start to just accept it. You know, may she rest in peace. Joan Rivers was a great example of that, right? She she admitted to having procedures and stuff done. So, no shame to her, but it was one of those things that she had a very full face and then we just got used to it. Right. And same with Simon. And to answer your question about reversing it. So the reversal of fillers is something that is possible. However, it's an indiscriminate reversal. And so there's a cautionary tale to be told here in that, yes, fillers can be reversed with a product called hyaluronidase, which breaks down hyaluronic acid, which is the main component of the majority of fillers that are on the market. There are some fillers that are not reversible. There are some that create essentially calcium or bone. And then there are some that are human fat-derived fillers that are also not reversible, right? So there's the cautionary tale in those, in that injecting those, you can't necessarily reverse them completely. And so the real story is that if somebody's getting overfilled, if you're going and trying to dissolve it, that hyaluronidase is actually not discriminate. It's indiscriminate. It will not only get rid of the filler, but it'll also break down some of your own tissue. And so that can also accelerate aging. And so that's where a lot of caution needs to be taken when choosing to do these procedures and trying to get this, chasing the fountain of youth through fillers, I think is a very, very cautious procedure. I think maybe 1 or 2 filler treatments here or there to kind of temporize and kind of delay the aging process, I think is fine. But once people are going on a routine basis and just getting the same amount of filler refilled and refilled and refilled, I think that's where it becomes dangerous because there is no reverse button for that. The other thing with that is that the filler, there's a lot of spectral MRI techniques now that we're starting to see come out that we're seeing that the filler, you might inject it here, but the filler, there are fat compartments in the face. And that filler does not necessarily stay in that single compartment. It can actually start to go down and it can start to spread and move around the face. And so what we used to think that it's staying in one area, it's not actually holding true. You inject the lip, it starts going in and migrating into the upper lip, making the upper lip full. And we've seen folks that look like that, right? That the upper lip starts to get unusually full and starts to separate from the face. And then when you go and dissolve that, it's actually now made that upper lip long. And that's a key thing that actually ages your face very quickly. A long upper lip is one of those aging features. And so there are procedures that are designed to shorten the upper lip and make the lips look more youthful. But that's where people need to be really, really cautious to avoid that.
I feel like you as a plastic surgeon, you're going to get so much work now from fixing people, from doing all these things. And I think especially these big lips, when young girls put too much fillers in their lips to have these big lips, and then they can't stop doing it. And then that happens, that what you just explained, that, it falls down and then you can't see the teeth anymore. And then you need surgery to fix it.
Yeah, I'm seeing a large number of patients, and this is something that we used to see in the aged patient, probably in their 40s, 50s, 60s. Right now, we're seeing it in patients in their late 20s and 30s because they have filler fatigue. They've filled their lips so many times, and now the filler's migrating. And then when the filler migrates, they'll go and have a nurse dissolve the filler up here, and that dissolving, like I mentioned, will dissolve the filler, but it also dissolves the tissues. And so it accelerates the aging process. So it's one of those things that I think a little bit is good and can really give you a lot of aesthetic youthfulness, but a lot in the face in particular is definitely not good and can be very.
Yeah. And I think, as you said in the beginning, kind of also goes with the filler blindness for the person who does it. And if you're a celebrity and you just go to a plastic surgeon and say, fix this, and then they just do more and more and more, and they don't even realize how weird they look. Because it just makes you look weird. It doesn't make you look younger. And that's where people go overboard, and it just it's not really reversible, as you said. That's kind of scary that, it could actually have the opposite effect if you go too far.
Absolutely. And I think that's where I think, I'm fortunate that my practice is not driven by doing surgery. My practice is driven by taking care of people. And that's the way I see it. And there's a lot of surgeons that are the same as me. It's not unique, but I think it's really important for folks to find somebody that is in that manner, that is there not to just charge you and do another procedure on you. And you could tell there are certain people that are very salesy and they're really just trying to push you. You walk into the office going in for a little bit of lip filler and you leave the office getting, nose, cheek, Botox, all this other stuff. And I think in those situations, I think you should really, really consider what has just happened and make sure that is in line with your goals. Because if it's not, then that might not be the right surgeon for you. And I've had a lot of patients that have come in and asked me, hey, doc, can we re-inject this? And I will say no. I'll say, look, I'm not going to do it. You're going to find somebody that will, but I really think that this is where we've reached our max and this is not going to look right. And then especially for me, my goal is never to have anybody out there in the wild, I call it, that somebody sees them and they're like, oh my God, who did that to you? And then they say my name. I was like, no, I don't want to be associated with some of those filler treatments.
I totally get it. That's a nice way of looking at it. Some people might just need therapy and then do that first and then come back and okay, look at it with fresh eyes. I also feel now, because everyone's on Ozempic, especially in Hollywood, and they lose so much weight and then their face start looking different. And then
100%.
do you see a lot of those people come in and even do plastic surgery then on their bodies too, I can imagine, because you have a lot of loose skin
for sure.
and stuff.
Absolutely. So the peptide revolution has really changed a lot of things. And not to mention, as part of the youthful factor, right, there are peptides that improve youthfulness, improve collagen, and there's a lot of different things that can be used in terms of rejuvenation, in terms of the peptide help. But there's also the weight loss aspect of, the semaglutides, like the Mounjaro, the Ozempic. And the interesting thing about those in particular is that, yes, they make you lose weight, but those two in particular are also culprits in total tissue loss. And this is something that, again, another cautionary tale, where a medication is good to help people with diabetes and being overweight and help losing weight in the people that don't necessarily need it, but are wanting a little extra boost, which is very, very common in this town, right? You get very thin, lean folks getting a little acceleration of weight loss for videos, for shoots, for all of the things that are, the pressures that exist in this town, right? They're not just losing fat, they're also losing soft tissue, and they're also losing muscle and bone. And if people are not resistance training, meaning lifting weights and counteracting that there is really deleterious, very bad effects of taking those medications and not working out and not exercising that could affect how long you actually live. And that's one of the things that I think is very critical. So whenever I have a patient that comes in and tells me that they're on, Ozempic or Mounjaro, I ask them, are you weightlifting? Because the number one thing that can end your life early is frailty. Not having any muscle mass equates to shorter lifespans, right? And so that's a critical component. But the other thing is the soft tissue loss. So what I mean by that is you lose fat, you lose collagen, you lose structure to the face. So it ages the face, even though they're not massive weight loss, that when we see patients lose a ton of weight, that we see the aging face because their face had a lot of extra volume and now they lose it. Even in patients that have normal body habitus to start with, that are within a normal weight range, and then they get on these products, they start to age their face because they start to lose the soft tissue because of the way these medications work.
Wow. There is no free, what do you call it? I mean, there's no shortcuts, I guess you could say. If it's too good to be true, it is too good to be true. And everyone's like, okay, if you can just take, a pill or something to just lose so much weight and it's not making you suffer in any way. I mean, it's kind of interesting. So
it's a little bit of that, what they call the double-edged sword, right?
Yeah, totally. Very interesting, because I've never heard anyone talk about that before, that you need to, lift weights and do all these things when you are on these kind of medication, and how important that is. It has not been really talked about that much. And,
No,
anyways.
I think that's something that's really, really critical. If anybody were to take home any point from this conversation, because it's so prevalent, right? You can get them at little med spas and you can get them all over the place now. You can get and people are losing incredible amounts of weight and kind of overcoming previous hurdles, which is great, right? But at the same time, if that doc is not telling you to weight train and to make sure you're maintaining your muscle mass, please do, because that's the one thing that I think will shorten lifespans if we're not careful.
Very good. Thank you. So what would you recommend? For people like my age or older, I don't think any young people should do anything. I feel like when I look back, I'm like, why wasn't I happy with the way I looked? I was 20 years old, 30 years old, who are thinking like, okay, I want to do something to look young or to look younger or to look refreshed. What would you tell people to consider then?
So I think the first thing starts with, like I kind of mentioned and alluded to a little earlier, is really good skincare. Really good skincare includes a moisturizer, a retinol, something like, retinols are vitamin A derivatives that they sometimes make people's skin peel a little bit, and then that peeling stops, and then you now have a fresh layer of the top layer of the skin, which is called the epidermis, right? So moisturizer, retinol, and sun care, sunscreen, sunblock, right? That's the basic. Everybody should do that. And that's going to give them a layer of youthfulness. The next evolution of that is doing laser treatments to help with pigmentation, right? And there are some creams and things that can help with pigmentation that's associated with sun and aging, right? So removing some of the sunspots and the aging spots can be done with certain lasers and can be done with certain creams. Then the next layer is doing something for skin resurfacing or skin rejuvenation. And that can be a CO2 laser, that could be a fractionated erbium laser. And in those treatments, it is essentially, if you were to equate it to doing lawn work, right? It's like aerating the lawn, that you punch little holes in the dermis and it builds collagen and it helps restore the youthfulness and it increases the collagen that we lose as we age, right? And so that's kind of the first series of steps. Now, there are some minimally invasive procedures that can be done at the sign of early aging that are energy-based treatments or even non-energy-based treatments with microneedling, right? So needling, again, it's going back to that poking little holes in the skin to cause collagen to grow. And that can be combined with PRP, which is that platelet-rich plasma that increases the stem cells and increases the tissue response to these treatments. And then, or the PRF, there's different options in order to kind of augment that. And then there is the needling with energy. And so there's devices like Morpheus that will essentially put little needles into the skin and then deliver controlled energy in the form of heat. And that's another way to hyperstimulate collagen formation and to help tighten the tissues and make the skin a little bit thicker, a little bit more youthful, right? And so this is kind of the progression before we get into the surgical aspect of things, right? So you start with skincare, then light lasers, then deeper lasers, then you start with energy-based needling treatments. And everybody's genetics and everybody's kind of aging is different. There are some patients that in their 30s, it might be right to do some of these energy-based treatments. In some patients, it may not be until their 40s, but that's where that question of how gracefully do you want to age comes into the question, right? And that's an individual question. And that's something that each patient should have that conversation with their surgeon or with their doc that's taking care of them so that they can achieve the goals that they're looking to achieve, right? Then the next step from there is surgery. And that's where, the evaluation and the decision as to what to do and how to do it in a way that restores the youthfulness. Actually, let me go back one step. Before we go into the surgical, I forgot to touch on the Botox, right? So Botox treatments are something that when done properly, right, you can still have some motion, but we reduce a lot of the extra line formation. And that can be started, there are some folks that started in their 20s, and that's fine. It's a little harder for actors, to be honest with you, just because they need expression to be able to show the drama and to show everything that they're doing. And we've all seen the actors that have had too much, that when they're trying to create these facial expressions, it doesn't look right? And so there is something to be said about doing light Botox or doing softer treatments that we soften the amount of lines that are created when we create expression. But it also helps, it's also in the preventative nature to not create too much creasing and too much lines as people age, right? And then there's also the fillers. That fillers can come into play when, there's little areas that you're not quite ready to pull the trigger per se to do a surgery or to do a surgical procedure, that you can soften sometimes the under eye lines or sometimes the nasolabial fold, or add a little bit more volume back to the lips that have been lost with time. I think there's definitely room for filler in the surgical care of patients. And it just needs to be judicious, right? And then from there, we transition to surgical procedures. And in the surgical procedures, there's actually fat transfers that can be done to the face, and that can be done under a local anesthesia with numbing shots and patients wide awake, that you can use your own fat as a filler, which is a natural filler and is less likely to cause some of the side effects of using too much filler, which is blocking lymphatic channels. So we've seen a lot of the under eye filler tends to migrate or move into the lymphatic channels, and it leads to puffy bags under the eyes, where we don't see that as much with doing your own fat transfer to this area, right? So there are other options that don't include, using a filler that can give you a very nice natural result. And it is a natural result because it's your own tissue, right? And then from there, we go to the eyelid lift, the brow lift, the full face lift.
Wow. Okay. So there's a lot we can do before going to like the more extreme and like go under the knife, as you say.
For sure.
Well, this was really, really interesting, and so many things to consider here, so many things I didn't really know about. I think all of us just want to look the best we can and not go overboard. So yes, thank you so much. So everyone can find you on Instagram and follow you there and see some before and after stuff, I'm guessing, as well, that you're sharing. So yes, thank you so much for taking the time. I really, really appreciate it.
Thank you so much for having me. I really appreciate you. It was a great conversation. And we're always here if you ever want to chat about anything else.
Thank you so much to Dr. Nathaniel for this. As I said, I will leave a link in the description here and in a pinned comment, so you can go and check him out if you're more interested in what he's doing. I hope you learned a lot and that you put a lot of thought into the things that you want to do to your face and to your body, because some of it, as he says, is not reversible. Anyways, that's it from you guys. Thank you so much for watching. And please subscribe if you haven't. Check if you've been unsubscribed and hit the notification bell so you never miss an episode of Flossom Talk. And I'll see you soon.
Yeah, we Flossom Talk.